This is Eyewitness News with live breaking news.
And right now we are joined by Pomona Valley Hospital's Director of Trauma, Dr. Michael Jimenez. Dr. Jimenez, when you see images like this and you see this mass casualty situation, what is it like for the surgeons receiving all of this?
Yeah, these are moments where I believe that it's very important for a trauma center to be ready. You know, and this sort of hits close to home. I actually trained at the University of Maryland at shock trauma, so it's not too far, and this is something that I think all trauma centers, as a matter of fact, at Pomona Valley, just last month we actually prepared and trained for a mass casualty event. It's important to do that, and we do it on a quarterly basis just to make sure that we can provide for the constituents of our area and the neighboring surroundings.
And how is treating gunshot wounds different than other types of injuries that you see in the ER? Excellent.
That's a great question, and I think, you know, with high velocity penetrating trauma such as a gunshot wound, you know, there's many organs that could be injured. So we have to be ready at all times, 24/7, have a full team in-house and with the functioning operating room, blood available, and all the personnel in order to take care of someone that's gravely injured.
Well, let's talk about some other injuries that you're probably expecting to have happen. The 4th of July is coming. We know emergency rooms get very busy. So what are some of the injuries that you see most often?
Well, as you mentioned, fireworks are a big deal, and I think it's very important for us in the community to realize to stick to fireworks that are sold at your local vending areas, not to use illegal fireworks. We see a lot of fingers that are mutilated, burns to the face, explosive components and injuries to the face, and so we'll see plenty of that. The other scary component is when people come out and shoot a gun up into the air. A lot of stray bullets will come down and injure folks. So those are the key things to stay away from. And if you're thinking of doing that, please don't do that.
Yeah, exactly. And what about parents? What should they know about these fireworks, even the ones that are considered safe and sane? What precautions should they be taking?
Well, I think first and foremost to make sure that if you know, parents' supervision and adult supervision is paramount. I think to make sure to wear protective eye gear, that's fantastic. I think if they're legal fireworks and if there's adult supervision, that's the safest thing. Also, what we have to keep in mind is the use of alcohol. I think when you combine the use of alcohol with activity like that, you're setting yourself up for a bad event.
That's
my
really
goodness.
true.
Well, and I know a lot of us, we talked about it for a moment, but even sparklers, those are pretty dangerous.
Yes, incredibly dangerous. You can burn your eyes, and I think the mistake that we make, that we think a sparkler is nothing, it's no big deal, but kids will get it too close to one another, they'll poke each other in the eye with it, so adult supervision is paramount.
Love when we keep it keep it to the experts. You know, we always like to say that, you know, why not? Enjoy it from afar. Yeah, Dr. Jimenez, thank you so much for joining us, and
no problem.
Have a safe and wonderful 4th of July.
Thank you, likewise. Thank you very much, ladies.
Thank you very much.